Logbooks. Tissue? Oh, may need that later. Water? Here, my notes. Oh, here. Tuning fork, syringes. Got my Atkins granola bar. Some Miralax. Oh, God. Okay.
Where is this?
Oh, hey.
Oh, hey, good to see you. How are you doing?
Hi.
You're enthusiastic, aren't you? Okay, so are you ready for presentation?
I'm totally ready.
Okay, so one thing you need to make sure as far as interval events is to let Dr. Duche know that we gave IV carbamazepine last night to the patient.
Wait. But the MAR said IV lorazepam. She was seizing.
I put the order in. It's carbamazepine, IV.
I thought carbamazepine didn't come in IV.
I'm pretty sure it comes in IV. Anyway, just be sure not to forget.
Thank you.
You're welcome. Always looking out for you.
You're the best resident ever.
I know.
Hey, I know it's 5, and I said that we weren't rounding until 7, but we need to do it right now. Okay. My notes! Now it is 5:01. I'm so sorry, Dr. Duche. Okay. Miss Terry is a 24-year-old Vietnamese woman who...
Wait. Did you just say female? Because if you say female, it's female antelope, female giraffe. Like, I'm a little bit confused already.
Okay, she's a woman.
Okay, then why don't you say that?
Thought I did. 24-year-old Vietnamese woman with a history of type 1 diabetes.
Wait, I don't need all that social stuff. Just give me the important details.
I'm sorry. She presented with hypotension, fever, newborn rigidity, and purpura of her legs. And she was initially brought into the...
Wait. Any pertinent social history?
Without any history of drug or alcohol abuse, no tobacco either. And she was brought into the ED in status epilepticus. And she was initially misdiagnosed by the man who writes questions for the boards because he was so interested in the mechanism of disease. And after she was dragged off stage, we all thought she expired. But the nurse resuscitated her heroically.
I'm listening. Keep going.
So the nurse checked her glucose and found that her glucose was 19.
Wait, hold on. You said the patient had a history of diabetes. She's in status epilepticus. You know, a good medical student would know that the attending would probably want to know what her glucose was. And I'm seriously starting to doubt your ability to practice as a physician. You're going to go on this spiel about stuff that isn't important and then leave out what her glucose level was.
I'm sorry, her glucose was 19.
Okay, keep going.
And so we gave her D5W and IV carbamazepine.
Wait. Carbamazepine.
Right? Yeah, IV carbamazepine.
Common IV. You know what? This is taking too long. When you know your patient, why don't you try again? For now, I'm just going to have the residents present.
Okay, so about this lady.
Ooh, I need these.
We also We also have psychiatry. My patients are crazy. They really are crazy. Are they turning me crazy? Probably.
Hi, I'm Sandy.
Hi, Sandy.
So, it was my first day at Schmick, and you know how Schmick, they give you these keys, because it's a locked facility, right? And so you're supposed to be able to get out with these keys. And there's this really aggressive patient, and she was spitting on people, she was kicking out windows, or at least trying to. Needless to say, she was the reason for multiple codes that day. So I'm winding down my first day. And I unlocked the glass door from the inside, you know, and I go out to the courtyard and I'm locking it from the outside. And my key gets jammed. And I pull it, and nothing, I can get this lanyard off. And I'm just thinking, oh shit, there's just a piece of glass between me and her. Dumbass! Can't you see this lady needs some help? Useless.
Hi, I'm Claire again.
Hi, Claire.
So I know what you're thinking. Is she going to talk about poop again? The answer is yes. Yes, I am. Dr. Tom, I'm sorry for what's about to transpire. So you might not know this, but in 1998 there was a landmark paper by Hal Gord et al. And that was expanded to be the Hal Gord triad, and then later someone else made that into the ABCDs. And it helps us decide poop smearing, feces, and what it all means. So A is for asymmetry. Is it on one side or both sides of the wall? B is for blood, because we always want to know about blood. C is for consistency. That's where that Bristol poop scale might be. And then D is for diabetes, because we always want to know about diabetes. There's a couple different ways to number them, and then based on the scoring, we have like 1 to 3. That's like totally disgusting. And then like 3 to 5 is like completely grotesque. And then if it's 6 plus, it was probably your MS3, and it's time to let them go home.
All right. Math students. Hello. Chop chop.
Oh.
All right, front and center, let's do this. Okay, so at the end of your rotation, nice job. Evals. So, that was probably one of the best skits I've ever seen. I'm just so proud of you guys. You really nailed it. You made me believe in the struggle that you went through. You made me realize how much I've learned since I became an attending. Internal medicine is amazing. And I'm proud of you. You guys really deserve the best marks, and I had to choose because I couldn't decide if I wanted to go a little bit higher. Okay? 4. Did you hear that? 4. Cool, thanks. So, questions?
Wait,
Okay, sounds good. So, hey you, back there. Yeah, you.
Yes.
Male medical student. Cool. I don't remember your name, but it doesn't really matter. So, you're really funny.
Okay.
I really, really enjoyed it, but sometimes it was a little overdone. Just a little bit.
I agree.
I see the gears rolling and turning in your head. I love it. Your enthusiasm was great. I'll give you that. And, well, you definitely showed you contributed to the team. 6. Okay. So, I thought the skit for medicine was the best. So those of you that were in it, amazing job. Well, not only because I'm an IM attending. Well, yeah, basically because I'm an IM attending. But yeah, you guys did great. 5. All right. So, professionalism. You have to touch on professionalism. During the whole showcase, you guys were great. You got through all the changes in your scenes properly. Everything was done really well. And in all honesty, you showed me what it means to be a UC Davis medical student. You guys should pat yourselves on the back. Go ahead, do it. There you go. Okay. 6. So, all of you. Yes, all of you out there. You're not exempt. So, you could have been a little bit better as an audience. Maybe just a little bit. I was yearning for a little bit more. And all of you here in the front, you're smiling a lot. I really like that. I love the enthusiasm with that. But it was still a little lacking. I'm gonna have to go for a 2, guys. Sorry. But, a little bit of saving grace. I see that there's a lot of students that worked with me. All you graduating MS4s.
Yeah.
I see you all your smiling faces. Obviously, it's a 9. Because we all know that you guys are basically interns and not medical students. So, man, time is flying. Why are these forms always so long? Goodness. Okay, anyway, there's like 50 questions left, and I have dinner plans, so yeah, whatever. I'll just give you guys 8s for the rest. What?